Here we are. You clicked on the video. Thanks very much. I appreciate it. Yep, today we managed to get my coffee table in the house from the other location. This makes me very happy now that we're actually getting something that's close to a nice living room area. And I'm thinking more and more about the future and what's to come in the future when it comes to all the changes going on with the house, with the dog, and with the family that's coming, and the baby that's arriving, and my lovely girlfriend, and all the things that are to happen. And I'm thinking more and more about the future as far as careers go. So I'm working a lot of different jobs. Like I say, I do some entertainment gigs. I do some quality control jobs on the side. I do a lot of different work. So I work as an in-home caregiver, for instance, and I've been doing that for a while. I've been working as a peer mentor for another friend of mine. And it comes around with this study guide right here for the TEAS exam. TEAS. The TEAS exam is an exam that is necessary to take and get a good enough grade on so you can apply for certain admissions programs for certain fields you might be interested in getting in. In my case, I'm interested in occupational therapy. I'm going to go for a 2-year program at a local community college for Occupational Therapist Assistant. And I think this is a really good career choice for me for a number of different reasons. And I think it's a good career choice for people out there who are considering getting into healthcare, are interested in helping out other people with their everyday tasks, and want a good, secure future that has really good growth, really good job growth potential projected for the next 20 years or so. It doesn't take very much time in college, so a minimal time investment and a minimal financial investment, because there's a number of very good community colleges that offer programs for occupational therapy assistants to get started in their career as an occupational therapy assistant. And you can always keep going. You can go for another 4 more years to become an occupational therapist. So I'm excited to move forward in the field of occupational therapy. Now, occupational therapy isn't what many people would assume if they just hear the terms. It's kind of like how people misuse the term logic when they're talking about something that's logical or not logical in everyday language. When it comes to occupational therapy, there's an academic definition of what they refer to as occupational. You think occupation must refer to one's job, how they occupy their time for work. But it's different for occupational therapy. Occupational therapy refers to how someone occupies their time in general. So this includes work. This also includes what they call ADLs, or activities of daily living. Activities of daily living can include household chores, leisure activities, recreational activities, and so on and so forth. The things we like to do with our time throughout the day. It's kind of profound, really, if you think about it, how you occupy your time in general, how you choose to spend your time. It's our most precious resource, like I've said in other videos here on my channel. Time is a very, very elusive thing. It's something we don't know how much we have, but we know that it's going to come to an end eventually. And that's all we really have at the end of the day. That's the most valuable resource we have. I'm convinced of it, at least. Because without time, we don't have anything else. You can't enjoy good health, you can't enjoy a good life or anything. So, with that being considered, occupational therapy is something that refers to how one occupies their time on a daily basis. And the purpose of an occupational therapist and the occupational therapy assistants is to help people maintain, obtain, or preserve their abilities to do their activities of daily living. So this helps out people with disabilities, people who are in accidents and have to have physical rehab. They'll see a physical therapist, and very often, more and more often these days, you'll also see an occupational therapist, and also people who are elderly, the geriatrics. So people with disabilities, people who have been injured and lost abilities, or acquired disabilities in some cases, and older folks who have acquired disabilities as well. So what an occupational therapist can do is different than just what a physical therapist can do. A physical therapist will help you to strengthen muscles in a healthy way based off of whatever your particular ailment is. In occupational therapy, it's not just about the physical, it's the holistic thing. It has to deal with the whole package of a person. So it's very person-centric, it's patient-centric, it's consumer-centric, if you will. And what you do with it is you figure out what the person's all about and how they value their time, because time is the most valuable resource, like I said, right? So we have to figure out how this person wants to spend their time on a daily basis, and the occupational therapist helps them fulfill those goals with how they want to spend their time. So it's things that we can take for granted, like doing our dishes, or playing guitar, or walking tightropes in my case, and doing other silly human tricks that I like to do. So the occupational therapist can help people maintain, obtain, or preserve their current level of abilities. Because in some cases it can be helped, in some cases it can't be helped. There are some people who will never be able to walk, have never been able to walk their whole life. There's nothing we can do about that. But in some instances, there's ways we can help people figure out how to do things, especially for those who have acquired the disability of not being able to walk. We can show them how to get by easier in their day-to-day activities with this new handicap that they have, this new disability they've come across. For instance, if they have a stroke, for instance, and they used to play guitar, well, then maybe we can find ways to help them fulfill their dreams to be able to keep doing their music. So occupational therapy is a very noble goal, I think, a noble profession, a respectable profession, and it's got very good job growth in the future going forward the next 20 years or so, and amazing projections, because we're looking at the baby boomer population getting older, and they're going to need some assistance, not just with their physical therapy, but also with occupational therapy, as well as in-home aides, such as myself right now. So this will be a good step up, a good way for me to advance in the field that I'm comfortable working in and that I enjoy working in. I enjoy helping people. I like helping other people fulfill their goals and teaching people how to do new things. And I also love learning things from other people too. All the best teachers, I feel, all my favorite teachers I ever had, were really good listeners and were really good at learning things and learning how other people, and very observant people too, learning how other people like to absorb information. It's a really good skill to have if you're going to be an effective teacher, is knowing how to present information in a way that is accessible for different people and different levels of abilities or lack of. So occupational therapy, here I come. This TEAS exam study guide is going to help me get on my way. So I'm going to go through this book here. It's a pretty thick book, but that's okay. I'm going to challenge myself just to take the test without knowing or studying the guide at all. There's little practice tests in there, and see how well I do with that, and then go through and study and figure out more about what I need to know and what I don't know. And who knows, maybe I'll try a different approach. Maybe I'll actually go through each chapter and do it once at a time. But I like the idea of trying to do the test before doing all that. Anyways, that's for me to do later on. This is what's on my radar now. The house is finally coming around. Trying to make sure I use my time the best way I possibly can and just do the right thing. So many changes, and there's so many things going on in my life, and I'm sure there's plenty going on in your life, and that's why I want to thank you for taking the time to watch this video. I know I'm all over the place. You never know what you can expect when you watch one of my videos. And a lot of my videos, I feel, get to the point where people lose interest, and I understand that, especially with these past couple weeks with doing this filming on my phone with no editing. But that's okay, because I promised my viewers and myself that I would post every single day of this year. And I intend on fulfilling that promise, for better or for worse. I'm no longer afraid of making bad art. I'm no longer afraid of putting these videos out there, realizing that they will be on the internet forever. Because it's getting easier and easier with every post that I do to keep doing this. And by next year, I'm going to cut back on how often I post. Probably try to specialize with making certain kinds of content instead of doing this vlog style, and actually polish them up and make my edited videos like I was doing earlier this year. But right now, the responsibilities are piling up. I have to learn how to potty train German Shepherds. I'm looking forward to that, in fact, because that dog is absolutely adorable. I have to study for this TEAS exam because the test is going to be coming up in January. I have a 2-week vacation I'll be taking with my girlfriend to Mexico, so there's that going on, and I'll probably be doing some studying down there. And a house to finish preparing. So much stuff to do to prepare for this baby that's going to arrive. And I'm excited to move forward with doing all of it. And it's going to be all right. We're gonna make everything work out just fine. So thanks very much for tuning in. Thanks for listening to my little rant about occupational therapy and how I think it's a good profession and a good noble choice for people moving forward. Minimal time invested, minimal amount of money invested, high job satisfaction. Very rewarding profession, and it works in healthcare. There's a good track record where you get employers where you get good benefits, Really decent pay. You're looking between 40K to 70K, depending on where you land your job at and how many credentials you have and all of that sort of thing. And yeah, something to look at if you're looking for a career change. Maybe consider occupational therapy. There's plenty of space for more people in it, and there's a lot of good reasons. So look into it yourself. If I didn't sell you on it, it's worth looking into if you're looking at a career change, especially if you're interested in healthcare. That's a wrap, though. Thanks very much for tuning in. I post every single day of this year. I've organized all the content I've made this year into different playlists here on my channel, so you can click on those playlists and see if there's anything there that might pique your interest. It might surprise you. You might find something there. In fact, I feel pretty confident there's something there for everybody. So before I let you go, I'd like to remind you all to never give up, to do your best, to stay true to you, and to be amazing. And that's how I end all my videos, because why not? I think they're good words to live by. All right, you've had enough of me. I haven't had enough of you, though. I'll keep posting if you keep watching them. And till next time, my friends, thanks very much for watching. Good night.